Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for extract 1.
Extract 1. Questions 1 to 12.
You hear a physician talking to a patient. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, doctor. Good morning.
Good morning. Please be seated. What's your problem?
Well, I have been facing this problem with respect to tonsils for many years. I have throat pain.
Do you feel any difficulty in swallowing?
No, doctor, but I have got this habit of snoring loudly.
Do you get sleep apnea episodes?
No, doctor. Often, I am a mouth breather, especially at night times, doctor.
What's your age?
17. I had 3 bouts of tonsillitis this year. On an average, I get about 4 bouts of tonsillitis per year.
Okay. Have you had any illness, treatments, or surgeries earlier?
Yes, I had a cholecystectomy.
What medicines are you taking now?
Nothing, doctor.
Is there any family history of illness?
Well, my sister has ear infection. Rest of my family members have history of cancer, diabetes, heart disease, and hypertension.
Well, your physical examination results show your pulse is 80 and regular. Temperature is 98.4. Weight is 184 pounds. Your tongue, lip, floor of mouth are noted to be normal. Oropharynx does reveal very large tonsils measuring 3 plus or 4 plus. They were exophytic. Mere examination of the larynx reveals some mild edema of the larynx. You have enlarged tonsils. You have developed chronic angiotonsillitis with angiotonsillar hypertrophy, upper respiratory tract infection with mild acute laryngitis. You have obesity issue. I would recommend that you go for angiotonsillectomy. The risk may include bleeding, infection, scarring, regrowth of the angiotonsillar tissue. There may be need for further surgery, persistent sore throat, voice changes, etc.
Extract 2. Questions 13 to 24.
You hear a specialist physician talking to a patient called Julie Dooley. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. Your GP says you've been to see him about a lump in your breast. So, when did you first notice this lump?
10 days ago. I was doing my routine check when I was just so shocked to find it. It's in my left breast. I'm really worried because my mum died 6 months ago from breast cancer, and I've been scared of getting it ever since.
How old was your mum?
65.
Do you know if anyone else in your family has had it?
I don't believe anyone else has. I don't remember either of my parents talking about it affecting their own mums.
Are you married?
Yes, but we separated 9 months ago. He went off with another woman, and I'm on my own looking after my 2 children. I've got a girl who's 14 and a 12-year-old boy as well.
Have you ever been sick with anything serious before?
No, my health's always been very good.
I take it you're not on any medication then?
That's right, nothing. But there is something else that's been playing on my mind since I noticed the lump. I started remembering this pain I've been getting just here, in my chest. I never really thought anything of it before because it was kind of, I don't know, just very dull, like I'd pulled something, a muscle of some sort. So I really wasn't very worried about it. I just thought it would go away in time. But now, I don't know. Do you think it could be a sign of something?
That's difficult for me to say until I examine you and we run some tests. Is there anything else you can tell me?
About the pain? Well, it seems to go to my back. I usually only notice it when I'm sitting in a chair. Not a chair at the kitchen table. More like when I'm sitting in the lounge. You know, something with a high back on it. It did wake me from sleep once. It only lasted for about 15 to 20 minutes, but it was probably the worst I'd felt it. There hasn't been anything else really. Like I said before, I'm usually pretty healthy.
You haven't had any nausea or vomiting with it? No shortness of breath?
Nothing else except for what I mentioned. Oh, I do hope everything's all right.
Of course. Do you mind if I examine you now so I have an idea what we're dealing with?
No, that's fine.
Okay, there it is. Does that hurt?
No.
Right, it's quite solid, roughly 2 or 3 centimetres in length, I'd suggest. We'll need to run some tests to confirm exactly what it is. We can do those today, now actually, and then wait a few days for the results to come in. I'll need you to make a follow-up appointment on your way out today.
Okay, that sounds fine. I know I'm probably getting ahead of myself here, but if it is cancer, I really don't want to lose the breast. I'd hate to have a mastectomy. I dread that probably more than anything else. I really don't care what else happens, so long as I don't lose the breast. My mother had chemotherapy after she was diagnosed with cancer, and even though she lost all her hair, at least it grew back. I'd still be willing to try it.
Okay, well, you are jumping in a bit early here, but there may be options. First, let's run the test and wait for the results.
That is the end of Part A. Now look at Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now look at question 25. You hear 2 doctors discussing the new device to ease breathing difficulties in patients with chronic obstructive pulmonary disease. Now read the question.
Doctor, what about the new device that will ease breathing difficulty in patients with chronic obstructive pulmonary disease?
Decreasing the volume of lungs affected by emphysema or chronic obstructive pulmonary disease actually makes patients with the condition breathe more easily. If they take a breath due to the lung capacity, it causes shortness of breath. When we take a deep breath in, if it is hard to breathe up there, this is called shortness of breath, which our patients often experience. Therefore, reducing the lung volume significantly improves the quality of life. The new device resembling a valve is used for achieving this, and this is being tested in the US. Question 26. You hear a doctor explaining to his nurse about functional gastrointestinal disorders. Now read the question.
Hello, Doctor. Can you explain to me about functional gastrointestinal disorders in patients?
Well, functional gastrointestinal disorders is common in my daily clinical practice. This is characterized by difficulties in motility patterns and visceral hypersensitivity. If the patient is bloated and gassy, you should get them treated before the condition progresses. Bloating after meals, loose stool, constipation and gas are the minor symptoms of functional gastrointestinal disorder, while acid reflux, foul-smelling gas and abdominal distension are major symptoms of the disease. The symptoms such as foul-smelling sticky stool, hematochezia and the sense of urgency to defecate are the severe symptoms of the disease. Question 27. You hear 2 doctors talking about the differences between conductive and sensorineural hearing impairment. Now read the question.
Hello, Doctor. Can you differentiate between conductive and sensorineural hearing loss?
Well, conductive hearing loss occurs when a person experiences a difficulty in conducting sound waves anywhere along the route through the outer ear, syringa or tympanic membrane or middle ear. This may occur in conjunction with sensorineural hearing loss as well. While the root cause of sensorineural hearing loss lies in the sensory organ or inner ear called cochlea and associated structures, or the vestibular cochlear nerve or neutral part, about 90% of hearing impaired patients are of sensorial hearing loss. However, this can be mild, moderate, severe, or profound. Question 28. You hear a doctor briefing a junior doctor about eczema. Now read the question.
Hello, doctor. Can you please brief me on eczema?
Atopic dermatitis or eczema is a type of skin disease that causes an itchy, non-contagious rash. It can affect people of all ages, however, it is most common in children. For some people, it is a lifelong problem. Eczema is considered as an inherited health issue and associated with food allergies, asthma, and allergic rhinitis. Normally, this condition occurs when the skin is inflamed and could not retain sufficient moisture. The condition is aggravated by moisture from sweating or humidity and by extreme dryness and coldness. The condition is also caused by stress, irritants, and specific foods or dusts and molds. Question 29. You hear a doctor's dialogue on the vaccine for hepatitis B virus. Now read the question. For patients with advanced chronic kidney disease, including hemodialysis patients, a higher dose of hepatitis B virus vaccine is recommended. A higher dose vaccination may improve the immune response of the patient significantly. The hepatitis B surface antibody titer should be monitored 2 months after completion of the vaccination. Thereafter annually, with a target titer of 10 international unit or 10 mil. The vaccination schedule should be repeated if the patients do not develop a protective antibody titer after completing the initial vaccination schedule. Question 30. You hear a doctor explaining to his patient about a bone marrow biopsy. Now read the question.
Doctor, I was told to undergo a bone marrow biopsy and I'm very worried about this test. Can you suggest how I need to prepare for this?
Well, a bone marrow biopsy is normally advised to diagnose and monitor a variety of conditions. It can also be performed to diagnose or determine the extent of certain types of cancer. A bone marrow biopsy is performed through the procedure called a bone marrow aspiration to obtain a sample of the bone marrow, which is the blood-forming portion of the inner core of the bone. Usually, a bone marrow aspiration is taken from the pelvic bone called the ilium. That can be accessed from the lower back near the hip. The sample can also be taken from the center bone in the chest called the sternum, or the front of the pelvic bone near the groin.
This is the end of Part B. Now, look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer, A, B, or C, which best fits according to what you hear. Complete the answers as you listen to the audio. Now, look at Extract 1. Extract 1, for questions 31 to 36. You hear the lecture given by a physician on the standard method of diagnosing attention deficit hyperactivity disorder. You have 90 seconds to read questions 31 to 36. The standard methods of diagnosing and assessing attention deficit hyperactivity disorder used by mental health professionals is application of the criteria established in the Diagnostic and Statistical Manual for Mental Disorders that identifies 3 presentations of attention deficit hyperactivity disorder: combined presentation, predominantly inattentive presentation, predominantly hyperactive impulsive presentation. Functional neuroimaging, such as SPECT scanning, is considered an effective tool for researchers. Type 1. Classic attention deficit disorder. People with classic attention deficit disorder have reduced blood flow in their brain area of the prefrontal cortex, cerebellum, and basal ganglia. The basal ganglia produces dopamine. Type 2. Inattentive attention deficit disorder. People with inattentive attention deficit disorder are often described as daydreamers, space cadets, and couch potatoes. This type is more common in girls than boys and is often diagnosed later in life because people with type 2 inattentive attention disorder don't have behavioral problems. People with this disorder have reduced activity in the prefrontal cortex as well as low levels of dopamine. Type 3. Over-focused attention deficit disorder. People with over-focused attention deficit disorder have a deficiency of dopamine and serotonin. The aim of treatment is to increase both these neurotransmitters, the nervous system's chemical messengers. Type 4. Temporal lobe attention deficit disorder. People with this type might see or hear things that are not there, and learning and memory problems may be present. The patients will have irregularities in their temporal lobes and less activity in the prefrontal cortex part of the brain. The aim of treatment is to soothe neuronal activity and stop nerve cells from overfiring or firing unpredictably. Type 5. Limbic attention deficit disorder. People with limbic attention deficit disorder have excessive activity in the limbic section of the brain, which is where moods are controlled. They have reduced activity in the prefrontal cortex, both when relaxing or focusing on a task. Type 6. Ring of fire attention deficit disorder. People with ring of fire attention deficit disorder have an overactive brain. There are excessive amounts of activity in the central cortex and other areas of the brain. Type 7. Anxious attention deficit disorder. People with anxious attention deficit disorder have high levels of activity in the basal ganglia that aid in making dopamine. This differs from the majority of the other attention deficit disorder types, which have low activity in this part of the brain. It is possible to have more than one of these types of attention deficit disorder. For example, a common combination is overfocused, limbic, and anxious types.
Now look at Extract 2. Questions 37 to 42.
You hear a dermatologist called Dr. Anne Werner giving a presentation on the subject of vitamin D production. You now have 90 seconds to read questions 1 to 6.
Hello, my name is Dr. Ann Werner. I'm a dermatologist and author. Today I'm going to be talking about vitamin D production. We all need vitamin D. It spurs bone growth, and without it we'd be at high risk of conditions such as muscle aches, muscle weakness, bone pain, osteoporosis, and fractures. One way we produce vitamin D is through our skin, which our skin manufactures when it is exposed to sunlight. The sun's ultraviolet B rays interact with a protein called 7-DHC in the skin, converting it into vitamin D3, the active form of vitamin D. The problem is that currently, too many people think that using sunscreen and other forms of sun protection lead to vitamin D deficiency, and that the best way to obtain enough of the vitamin is through unprotected sun exposure. But that can lead to a whole other set of serious problems. Vitamin D helps keep your bones strong by regulating calcium levels. In recent years, some proponents of vitamin D have hypothesized that it does everything from decreasing cancer deaths and heart disease to inhibiting type 1 diabetes and rheumatoid arthritis. However, these suggestions are based on observational studies alone. This means that the researchers have observed that people with enough vitamin D have a lower incidence of deaths from these diseases, but not that vitamin D is the reason they are lower. While observational studies may be a good starting point, they are not proof or basis for medical recommendations. In contrast, there is an overwhelming evidence for the multiple benefits of sun protection. Controlled studies have shown that regular use of an SPF 15 or higher broad-spectrum sunscreen reduces your chances of developing squamous cell carcinoma by about 40%, melanoma by 50%, and premature skin aging by 24%. It has been proven on the molecular level that the sun's ultraviolet UV light damages the skin's cellular DNA, creating genetic mutations that can lead to skin cancer. In addition, UV radiation harms the eyes and can cause cataracts, eyelid cancers, and other ocular skin cancers. In short, unprotected sun exposure puts you at risk for any number of conditions that can permanently damage your skin, disfigure you, and sometimes even kill you. And the regular use of sun protection can go a long way to keep any of that from happening. High SPF sunscreens are designed to filter out most of the sun's UVB radiation, since UVB damage is the major cause of sunburn and can lead to skin cancers. UVB wavelengths also happen to be the specific wavelengths that trigger vitamin D production in the skin. Nonetheless, clinical studies have never found that everyday sunscreen use leads to vitamin D insufficiency. In fact, the prevailing studies show that people who use sunscreen daily can maintain their vitamin D levels. One of the explanations for this may be that no matter how much sunscreen you use or how high the SPF, some of the sun's UV rays still reach your skin. An SPF 15 sunscreen filters out 93% of UVB rays. SPF 30 keeps out around 97%, and SPF 50 filters out 98%. This leaves anywhere from 2 to 7% of solar UVB reaching your skin, even with high SPF sunscreens. And that's if you use them perfectly, of course. Even committed proponents of unprotected sun exposure recommend no more than 10 to 15 minutes of exposure to arms, legs, abdomen, and back 2 to 3 times a week, followed by good sun protection. That minor amount of exposure produces all the vitamin D your body can muster. After that, your body automatically starts to dispose of vitamin D to avoid an overload of the vitamin, at which point your sun exposure is giving you nothing but some damage without any of the presumed benefit. The thing is, even just those unprotected 10 or 15 minutes are way more than enough time to cause DNA damage, and every bit of this damage adds up throughout your lifetime, producing more and more genetic mutations that keep increasing your lifetime risk of skin cancer. The question is then, if not from UV exposure, where should you obtain most of your vitamin D? Fatty fish such as salmon, mackerel, and tuna are especially good sources. Small amounts are also present in egg yolks, beef liver, and cheese. And many common foods such as milk and orange juice are fortified with vitamin D. It is possible then, though sometimes difficult, to mix and match these foods to get the daily allowance of 600 international units recommended for the average person between the ages of 1 and 70. However, if food sources aren't enough, you may need to add in a supplement. Remember though, that most nutritionists believe food should always be your first choice, with supplements used as reinforcements. The bottom line is food, supplements, and incidental protected sun exposure will give you all the vitamin D you need.
You hear an interview with a radiation therapist called Roger Atkins, who treats patients with cancer. You now have 90 seconds to read questions 1 to 6.